Good evening, everyone. I think we'll get started. I'm sure you all have places to go after this. It's such a pleasure to have you all here and to see so many familiar faces. We're really grateful that you chose to spend your Monday evening on a very gloomy January night with us. For any of you who have not yet had the chance to say a hello to and to welcome, my name is Francesca Oakeman-White, and I'm the founder of the Beauty Triangle. So for many of us, January, the month that we're in now, is a time to reset. But before we launch headfirst into some punishing detox, diet, regime, I think we all just need to take a little bit of a step back, and we just need to sort of remember that January is also a time to repair and to recharge, and sort of really get our bodies on the right footing for the months ahead. Many of you will also know that the Beauty Triangle was set up as a way to educate and empower our audiences on all aspects of their health and well-being, and always from a holistic standpoint, which is why we've always selected the most authoritative voices in the world of wellness to introduce you to, including our amazing panelists tonight. So I'm really excited to be joined by aesthetic doctor and skin expert, Dr. Aggie Zatonska, by breast and body focus surgeon, Ms. Nora Nugent, and by acclaimed healer and face whisperer, Beata Aleksandrowicz. And I hope I said that correctly, Beata. And they're here to help us discover the most modern day routes to looking and feeling our very best selves. You know, the technologies and the treatments that are going to supercharge our skin, strengthen our bodies, but also the ancient practices and the rituals and the therapies that are going to really help build self-esteem and boost our confidence. So without further ado from me, I'm going to hand over to our brilliant ladies. They're going to say a quick hello, and then we'll get started with the main part of the conversation. So Dr. Aggie, over to you.
Hi, I'm Aggie Zatonska. I'm an aesthetic medicine doctor and founder of Atelier Clinic in Surrey. What an honor to be here
Live
in this
with
live finally with in this lovely company. Really honor. Thank you so much for having me. And yes, over to you, Nora.
So I'm Nora Nugent. I'm a plastic surgeon based in Purity Bridge Clinic in Tunbridge Wells, and I operate in East Grinstead as well. And my focus is on restorative and rejuvenative surgery within the field of aesthetics. And so it might be post-pregnancy or aging or after weight changes. And I too am very pleased to be in a room with actual people after 2 years of video calls. So it's very nice to see you all.
Thanks, Nora. And Beata.
Hello, my name is Beata Aleksandrowicz. I'm also so happy to be here and see you face to face. It's really nice. Thank you very much, Francesca, for inviting me. I am therapist, healer, and founder of Beata Love Life Beauty brand.
Thank you so much, Beata. In fact, thank you to all of you for being here. An amazing beauty triangle for tonight, and exactly the sort of women who I would love to be discussing the power of healing with. So thank you for joining us. Dr. Aggie, we'll start with yourself. Obviously, you've sort of introduced yourself. You're an aesthetic doctor, founder of Atelier, but you also have a very holistic approach to addressing the face, the skin, and the body when it comes to your patients. I mean, what are your patients looking for from treatment when they come to see you at this sort of present moment?
I'm on a bit of a mission in January, just to start with this philosophy of being a little bit more kind to ourselves. I think we're very, very critical at this point, and also very tired. It's been really hard 2 years. You know, people suffer from long COVID. They feel overwhelmed and really, really tired. The lack of sunlight, you know, it's not a nice combination. So when
the uncertainty of even
absolutely,
what's coming around the corner.
and all what we've been through for the past 2 years. So and I see patients in a very, very vulnerable moment, because when they come to see me for the first time for a consultation, they feel like they need to almost present all the negative things that they don't like about themselves. You know, they come to me to talk about things that they've trying to hide and camouflage for a long time, and that was something that was bothering them sometimes for years. So when they come to see me, I try to change a little bit this narrative and actually find the things that are beautiful about them, and tell them about it, and actually tell them, you know, you have beautiful bone structure, you have beautiful skin, and how we can take care of it, and how we can then make sure that we're taking the best care and actually making sure that this is our focal point, not all the negativities.
And I think it's so nice because I think as women we so rarely look at ourselves in the mirror and focus on our positive attributes. We'll always zone in on the thing that
Exactly.
the spot or the wrinkles
Don't
or
like this, don't like this.
exactly.
And we have to
I think we
change.
need I think it's actually amazing to have an aesthetic practitioner who can really drill down into what does make us unique and help us celebrate that through the work that you do.
Yes, and I think this is the whole art in it, is just find what makes us individual, what makes us individually beautiful, because everybody has those features, and the question is to find this and enhance it, but also to help to maintain what we have. That's another
Exactly.
thing. So for me, it all starts from the skin, analyzing, just to see how we can pick things that are happening over the time quickly enough so we can slow things down,
Yeah.
and then discuss another things.
It's nice,
how
it gives
we
you a
can-
roadmap somehow when you have
Absolutely.
that understanding. And I feel like you and I often talk about the power of combination treatments, really layering different things. I think that's really key to your approach. But, you just identified that a lot of patients are feeling vulnerable. Perhaps their confidence is at sort of rock bottom and they need maybe a little bit of a pick-me-up. Is there anything that you sort of offer in clinic where you're able to really give women that confidence boost and that feeling of, recognizing themselves in the mirror again?
Absolutely. So I am a huge advocate of combination treatments because aging is multifactorial. It's not one thing that happens to us that makes us change.
That's so true.
So in a way, I try not to change how my patients look. I'm trying to preserve the best features, but time is going to change us, and that's going to happen.
And I think
So-
also, you're right, time will change us, we will age, and that's also something to be celebrated. So it's nice to sort of work in tandem with somebody who can help us navigate that change and that
Yeah,
time.
on our terms, on our
On our
terms.
terms, yeah.
So it's good
It's so
to do
true.
it on our terms, and but also I think when we start from the basis and we start from analyzing the skin and basic skincare and how we can prevent things from happening on this level, it gives us a little bit of control back. So we feel like we're not so overwhelmed by all the possibilities that are out there, because it is overwhelming. There are so many things that patients read, and when they come to me, they are overwhelmed. They don't know
Exactly.
which way to go, where to start, and we actually need to break it down to basics and then combine the things that they actually need.
Yeah.
So it needs to be followed. That it needs to be a full consultation, medical consultation. When I'm looking at all of the factors that make them have the problems that they have coming to me.
Yeah.
And then start to build this journey. And I always explain it's going to be a process. There isn't or shouldn't really be a quick fix.
We don't want
we
an
should-
overnight transfer. In fact, we don't even want a physical transformation. And sometimes the
Exactly.
best treatments are the ones that go onto the radar.
It's a long process, and I see my patients for 10, 12 years regularly, and we're aging together, and we're kind of finding those ways of tweaking those things that are bothering us together. But combination treatments are important. So we combine things like facials with LED, with light treatments. We combine things like microneedling with radio frequency. That's this recently famous Morpheus 8, for example.
The GD Murray transformation.
Exactly. But we add to it, so we combine it with even more. We combine Morpheus, which is already a combination treatment, with LED light in the end, just to kind of boost this collagen production even more. We're using skin boosters like Profiler, which, by the way, in its own is a combination treatment because it consists of two different molecules, hyaluronic acid, and that's kind of mimicking what's happened to the skin during trauma.
And skin
Like
boosters, just to
stimulating.
recap for anyone who's not had them, non-volumizing hyaluronic acid, which you're
Yeah,
injecting
which
into the
just
skin.
kind of boosts our own collagen production, hydrates the skin. So really, really nice treatment. And
What's so interesting is that you've said the word boost so many times. Boost confidence, boosting collagen production, skin
Exactly.
boosters. I mean, that's really what a lot of these treatments are about.
And sometimes that's enough. And sometimes, it depends where patients have their own boundaries as well, because not everybody wants to go all the way, to injectables. Some patients just want a little bit of advice on their skin care, medical skin care, and that's enough for them. Some patients want to take it a little bit further and talk about, what can I do to prevent things, and some already have some visible signs of aging that they want to address, so we can do it very gently obviously respecting their anatomy, making sure that this is all about prevention.
I mean, aging is obviously one thing. I mean, some women in this room here don't even look like there's a wrinkle on their face yet. So what about people who are also more concerned with, I suppose, fundamental skin health? You know, maybe it's sensitivity, maybe it's acne, maybe it's pigmentation or rosacea. I mean, how can you go about really helping somebody heal the skin from those sorts of conditions?
So again, we have to go back to consultation. Why those things are happening? What are the factors that are, changing the skin in the ways we don't want it to change? So whether this is sun exposure, or whether there are some interesting factors, whether there are hormonal problems, whether there's some inflammation that's like rosacea, whether this is acne. So we have to diagnose.
You have to be an investigator.
We have to investigate. We have to diagnose those conditions and then act accordingly. So I don't like to kind of jump into things that are a little bit more aggressive to start with. We need to first address things that are that we can help with the skin to kind of help itself to
regenerate
to
itself.
generate,
Exactly. Just to get the skin working
to
as
renew
as
the
it
barrier
would.
of the skin, to help to reduce the inflammation in the skin, and then we can work towards more aggressive. I'm not doing any aggressive treatments in a way. This is all non-surgical treatments.
More focused treatments.
But more focused treatments. But the skin needs to be ready for that. So it needs to be able
about
to
preparing the canvas. And you spoke about LED a little while earlier in our conversation. Why is LED so powerful? Because it's something that we're seeing added onto lots of treatments, and I think you use it a lot as a way to sort of repair the skin and help sort of regenerate when the skin needs it most.
LED is a wave. It is a light of a certain wavelength that we use to boost the skin. Well, I'm using the boost again. To start the regenerating process in the skin. If you're using red light, for example, we are reducing the inflammation, we are stimulating collagen production. When we're using blue light, we are working against P. acne bacteria, so it can help patients with acne. But it's a lovely way to kind of calm down. It's a soothing treatment that...
it is lovely. You feel like you're just... I mean, this is such an awful analogy, and don't quote me on this, but lying under a sunbed, which I haven't done for many, many years, I promise, that was in my teenage years, but that sort of feeling of warmth on your skin, or sort of lying on a beach, you know, I think it's so important, particularly at this time
Everybody
of year.
loves it in January because it just helps you to feel better. Not only helps your skin, but helps you to feel better.
I think the mood enhancing benefits of light and warmth, you know, for anyone suffering with seasonal affective disorder, or just, you know, having a bit of a blue day, it's a nice thing to do.
Yeah, absolutely. And it helps for many skin conditions, but also it's a great addition to many of our treatments. So actually adding LED to hydrofacial, for example. So we're adding this at the end, just because it is such a lovely add-on that brings everything, you know, together to a different level. So
and you fall asleep under it as well.
Whenever they relax.
Whenever they say I'm going to switch on the LED lights, I'm like, oh no, I'm definitely going to fall asleep now. Have to be woken up.
And some of those treatments are not necessarily that nice. So, you know, by adding this little time to relax afterwards,
exactly.
It's pretty lovely.
I think you're so right. You need to balance these treatments as well. If they are on the more sort of aggressive side, as you say, a little bit more involved, then having the LED to soothe and calm the skin afterwards, and the mind and the body is really powerful.
It's all interconnected.
Thinking about the body as well, because I think you do a little bit of the manual lymphatic drainage, which I think is really interesting. It's something we're seeing much more in the aesthetic space. Why is that so integral to the work that you do in your clinic? Because it's a very holistic technique. It's more something I would see Beata doing rather than people in a medical clinic.
So we started to let me reverse a little bit, because we started to use Scalp Neo, which is the device that helps to strengthen the muscle, to build more
in the body.
muscle and strength, and reduce fat tissue at the same time. So I thought it would be the holy grail. So I thought it would be great to combine it with something that will help to eliminate the the fat tissue waste as well, you know, just to kind of speed up the results
And the detoxification.
and optimize the results.
Yeah.
We're testing 2 of those devices at the moment, and it's just such a lovely treat, and also it helps, you know, with the lymphatic drainage, with the inflammation, with you know, so that's something that is really nice.
I know you're still testing these devices, but are you seeing sort of beneficial effects even on the face as well? If you're sort of getting the lymph moving in the body, I'm sure it shows on the face.
The circulation, and yeah, absolutely. It's really something that we are looking forward to add very soon.
And then obviously once you've got the circulation moving and the skin is in the right place and it's healthy, then hopefully that means there's less work to do from your perspective in the more aggressive treatments as well.
The less I try to do everything to avoid the aggressive treatment. So the more we can do to prevent, to do little tweaks, to holistically approach the problem, the less aggressive treatment I'll have to do. And don't get me wrong, I love my injectables. This is my bread and butter. This is what brings me joy every day.
Yeah.
But there is a fine line. I try not to overdo it. I'm trying to respect the anatomy of the patient and just not to do anything that will be obvious. I think if this is obvious, then the magic's lost and it's not
I agree.
that attractive anymore. It attracts attention for all the wrong reasons.
I think we're not looking for extremes when it comes to facial aesthetics. I think we're looking for things that, like you said at the very beginning of our talk, bring out the best of you and celebrate your individuality. Going back to, you mentioned the Scalp Neo, maybe you can just explain a little bit more about what this is, because it's so relevant. I think, you know, talking about January and wanting to maybe fine-tune our bodies but without doing anything too punishing and too reductive. How does the Scalp Neo work for you?
This is very cool.
Yeah.
This is very cool. This is a combination of 2 technologies, the HIFM technology, and that stimulates the muscle, and the radio frequency that reduces the fat tissue. It is quite intense, like intense workout, but it makes you feel stronger. So
I would liken it to having a defibrillator put on you, which sounds very aggressive. Actually, it's not that bad, but
it's not bad. It's intense. You
it's
feel like it's lifting you off the bed.
Yes,
you know,
the muscles
when
are
we put it
contracting very vigorously.
abdomen. But it can be used on the arms, on the thighs, buttocks, abdomen, calves even. So that gives us a little bit of I think this holistic and well-being approach as well. Patients feel stronger after that, and they feel like because it's not instead of working out. It's not like, we're not trying to cheat here. Maybe a little, but we are just kind of taking
enhancing
it to a
the
different
workout
level.
that you're doing.
Yeah. You are a little bit stronger. You are a little bit more motivated as well.
That's so true, which is helpful in January.
Yeah, it stimulates your metabolism. So you're going to be, because it's 4 treatments 1 week apart. So during this time, you're going to be metabolizing this fat. So we add a nutritionist advice when patients are doing it, just to take the most out of it, just to metabolize this fat when it's available, because it's like a window of opportunity to get the most out of it.
It's the combination treatments that you're talking about
again. And then I was thinking, no, if we can speed it up, if we can put patients in those pants,
in the manual lymphatic drainage pants as well,
yes, and get rid of this fat cells even quicker, that would be brilliant.
You just need to be able to sell all of those manual lymphatic drainage pants to us at home, so we can just lie on the sofa that's all the time.
That would be lovely.
That would be the dream.
That would be lovely. But yes, we can do a lot more for the body non-surgically, as we couldn't before, really.
We'll hit Nora's side of the story in like the next few minutes.
So now it is becoming a little bit easier, and I see really good results. But also it helps for patients' posture when we're treating buttocks and abdomen.
And I've heard back pain is completely, maybe completely is a strong word, but you know, very much reduced
for the posture. And now we're spending so much time in front of the computers, and we were working from home, being stagnated really for 2 years. That really helps you to start change into a little bit more healthy habits, I think.
Yeah, and they even say that the Sculpt is very good for when your sort of tummy muscles have split in pregnancy, the diastasis recti as well, just sort of knitting everything and strengthening it and healing the body in that way as well.
Absolutely. And sometimes we add a little bit of Morpheus body towards that, you know, especially after pregnancies. We can now use improve the shape, but also improve the
So that's the
skin.
radio frequency microneedling, but
Yeah.
for the body. So it's
But
sort
for
of
the
tightening
body and tightening the skin, and sometimes even sprinkle it with Profiler Body. That's our new
skin booster for
skin
the body.
booster
I've
for the
heard that.
body.
That's quite magical as well.
That's really good one for any skin laxity on the body. That's another combination that we can add to it. So we can take it to, depending on what patients' needs are,
Sure,
we
to go
can
down.
take it differently. But I would usually start with EM Scalp.
Amazing. And final question before we sort of move on to Nora, what can we all be doing from home to really enhance the effects of the treatments that you're doing for us in clinic?
Medical skincare. I know it sounds boring, but it's really, really effective. And it doesn't necessarily need to be expensive. You know, it's all about 2-3 products that are really working, that are really packed with active ingredients and have science behind it. And if this is the only thing to do, that's good enough. You know, if we're using a decent SPF, some antioxidants, you know, little bit of retinol maybe every now and then, but that should be after a thorough consultation. We love our new gadget, our skin analyzer, where it's all black and white, actually shows you exactly what
going on below
skin
the
needs.
surface. Oh, they're terrifying.
And it's not about our opinion anymore.
Yeah, that's true.
It's actually what happens. You know, it analyzes the redness and inflammation, the size of the pores, the sun damage, and you can monitor how things are changing
and
as
celebrate
we treat
that
patients.
improvement as well, which I think is really
Absolutely.
nice as well.
So medical grade skincare is the foundation, definitely. And then we can talk about, you know, maybe LED. There are so many quite
The
good
at-home
at-home
devices for
devices
LED,
these
yeah.
days. But I would definitely encourage everyone to book a consultation, a skin consultation, just to kind of talk about what can I do now
Yeah, exactly.
to improve my skin.
Even if there's no heavy lifting required, I mean, it's more about just having that understanding of your skin and knowing what your path moving forward
Absolutely.
might
And
be.
sometimes it boils down to stripping down. Sometimes patients come with a bag of products
that they use,
and
yeah.
they use
And it's too
7,
much.
10, 12 products on their face, and that it's actually counterproductive. It's not serving them well.
Exactly.
They're irritating the skin more than anything. So for me, sometimes it's just to strip it down, to say, no, just concentrate on those 3 products.
Detox
Rebuild
your
your
skin in January.
barrier of the skin. Yeah, don't
Detox your bathroom cabinet.
exactly.
Don't throw everything
Don't
at
be
it.
so harsh. Don't be so harsh on yourself.
Yeah,
And
exactly.
then we can take it further.
Perfect. Well, thank you, Aggie. That was super interesting.
pleasure.
Really nice to have you on the panel tonight. Over to Nora Nugent, our next amazing speaker, who, as you know, is a breast and body focused surgeon. She's working down in Kent. She also has a very forward-thinking approach to surgical healing, which I always find fascinating to hear about. Maybe, Nora, you can start by explaining, because working with breasts and bodies and, you know, doing a lot of labiaplasties and things, your clientele is predominantly female, I think we could agree on. But
Yes.
why would you say most women are coming to your door?
So I can almost divide it into 3 groups of people, and probably the biggest group are the women after pregnancy. So mid-30s, 40s, where the kids have taken their toll. Things haven't gone quite back how they were pre-pregnancy. And that is where I do a lot of my breast and abdominal work. And it's where the skin has been stretched, whether it's the breast or the abdomen, and once it's stretched so far, it doesn't go back. If you think of a pair of leggings, when you take it out of the packet, it's brand new. You put them on, it stretches. You take them off, they go back, but they don't go back exactly as they were when you take them out of the packet.
Particularly after sort of several children, I suspect.
And once you reach a certain point in pregnancies and breastfeeding, it's the same. Bodies do vary, so some people snap back more than others. It depends on skin elasticity, overall weight and health. But some people don't snap back quite as much. Yeah. And everyone, once they reach a certain point, it doesn't go back exactly as it was before. Yeah. And it's how many people reach that point. So that's the biggest group I see. Mm-hmm. I see another group of younger women where it's more a developmental problem, where, for example, breasts have developed unevenly. It's actually reasonably common to have quite different sized or shaped breasts.
And that's something that they've always experienced, you know, for the majority of their lives.
That's something since teenage years when their breasts developed. and they've usually been told, don't worry, wait a few years, it will balance out, but it doesn't always. And so that's a problem. And then the older group are the women who finally have the time and the sort of resources to do something for themselves. They've spent their lifetime looking after their families, and now it's time to do, the children are grown, finished college, and it's time to finally do something for themselves.
That's really interesting. And obviously the women who you're working alongside, you're helping them address physical but also emotional issues. I mean, how do you as a surgeon go about reassuring them about these issues that they come to your door with? Because it's a very delicate conversation. It's very sensitive, a lot of the topics that you're discussing with these women.
Yeah, it's often a very emotional topic, because sometimes it's the first time they've had to actually physically say out loud what they're concerned about and how long it's gone on. And as part of treating them, I have to hear the backstory, but it's often quite a difficult backstory to say out loud if it's something that's really, really psychologically affecting you. So it does become quite an emotional consultation at times. And I think I usually start by just trying to find out what the problem is, and not necessarily what the solution is, because people come in and say, I want a breast augmentation or a tummy tuck, but I try to go back a step and find out what the problem is
unpick
first.
their motivations almost for that treatment.
So what is the problem rather than what is it? We start with the problem rather than the treatment.
Yeah, exactly.
And the other thing to bear in mind is that there's a huge range of what is normal, and
that's so true.
Minor asymmetries or differences in shape and size are not necessarily abnormal.
Yeah.
So if someone is completely normal, I think it's quite important to say that. Or if these are normal changes after something that's happened, I think it's quite important to actually say this is normal. And we might still want to change something, or it might still be possible to tweak things, but it's important to know if it's normal or not first.
Yeah. And I think that's such a good point, because I think so often, so infrequently actually, women are seeing other women's bodies. Like we fixate in the mirror on the things that aren't right with us, but how often do we actually see, apart from maybe people on social media or supermodels or celebrities, other women's bodies? And so how do we know really what is normal?
And I think that social media has been very good in some aspects for aesthetics and plastic surgery, but it's set the bar very high in terms of unrealistic images and filtered images.
Exactly.
And most of the very filtered images, as well as being filtered, that's image number 200.
Yes.
That was taken, that made the grade to actually get posted.
Exactly.
So it's not a realistic interpretation of the average day at the beach or whatever it is.
That's so true.
So it's just about being realistic and honest, and it doesn't mean if something is normal, I won't change it. If there's a good reason to offer surgery, for me it's mostly surgical. If there's a good reason to offer surgery, I will still, and I can make a difference with surgery, I will still offer surgery. But it's just about unpicking the reasons why and what's driving it.
And making sure the patient is going about it for the right reasons.
Yeah, exactly.
And do you ever have to work in hand with psychologists or counsellors to ensure that women are sort of going down these routes for the right reasons?
Yes, so I work with a couple of psychologists and psychological therapists, and not all my patients see them or need to see them, but everyone as part of the health questionnaire before coming to see me completes a very basic psychological questionnaire. It's very, very rudimentary, but it's a good start point.
Yes.
And then we usually tease out things a little bit more in the consultation. And some people do benefit from body image counselling, or not. Sometimes it's post-traumatic stress, depending on events that have taken place in the past.
Yeah.
Or sometimes it's counselling as well as surgery. So it's not always instead of. Sometimes it's hand in hand.
Yeah.
And it really is quite beneficial.
I mean, a lot of the work that you're obviously doing through these surgical procedures is about rebuilding women's bodies and their confidence, but it's also about strengthening the body, I would argue. A lot of the work that you're doing is sort of almost reinforcing the anatomy, particularly if it's post, maybe weight loss, post-pregnancy, post very dramatic changes. Is this something that, your patients sort of comment positively on, like as they sort of go through midlife, like feeling like their body is stronger and more supported?
Yes, I think it really does make a difference, and it goes particularly for abdominal surgery, but breast surgery as well. For example, after breast reduction surgery, it can make a huge difference to posture, to ability to exercise, and I guess the recurring theme is confidence, and
Exactly.
it's not about nobody comes to see me wanting to be a supermodel. It's not that. It's about just feeling confident to be able to essentially live your life without almost, although it's a big deal getting it done, the reason for doing it a lot of the time is actually so you don't think about that body area, even though it sounds
because almost it
contradictory.
preoccupies women so much, and actually what they want is just to restore themselves, and they feel like they can't get back to that place where they just feel like themselves.
And that's actually exactly what a lot of women say, particularly after pregnancy or after weight changes. They don't feel like they used to feel, or like themselves, or they look in the mirror and don't recognise the person they see.
Yes.
And it's just it's affecting confidence, and it's actually sort of wanting to restore themselves back to where they were, and it's mind and body, it's all interlinked.
It very much is. And what I've always found very interesting, knowing several women who have been considering plastic surgery, cosmetic surgery, is how they battle with it internally themselves, as to even being able to justify why they're having that procedure. Because I think there's a lot of feeling of like selfishness wrapped up in it, that why would they put their bodies and their health on the line to do something that they deem to be about the surface and the superficial. So you must have to help them unpick that as well.
Yeah, so a lot of people do feel very guilty, and it's partly intrinsic to the woman themselves, but it's also society is very judgmental, and there's an immediate assumption when you hear the word plastic surgery that it's vanity and it's purely about appearance, and actually it's not at all. It's very, very much a spectrum of reasons, and it's often both physical and functional or health reasons intermingled with appearance reasons.
Yeah.
And actually, I would also argue there is nothing wrong with some of it being about appearance if it helps someone feel more confident.
Yeah.
That's different to vanity. They're two very, very different things.
I would agree with you. And we spoke about manual lymphatic drainage with Dr. Aggie sort of just now, and I know that's something that you're a huge believer in, actually, the power of manual lymphatic drainage and helping to heal the body after the procedures that you do.
So I work with a lymphatic massage therapist who has put together a package of treatments for my patients, and it's things like lymphatic drainage, or myofascial release, or tapings, and it really does make a difference to the early recovery. It helps. It's a double. There's a selfish side from me as well. It acts as another professional. The therapist I work with is very experienced, and I know if she's worried about anything, she'll call me, and it's an extra safety check for me,
another checkpoint.
at points where I might not necessarily have scheduled a follow-up appointment.
Exactly.
But in terms of what it actually does, it really helps the early recovery in terms of fluid drainage and bruising and swelling and tissue softening, and just speeds up the overall recovery. And it's actually applicable to almost all the surgery I do, whether it's facial, breast or body. It's applicable for almost all areas.
And how soon after the procedure can you have the manual lymphatic
very
drainage?
very early after.
Yeah.
The same day, or even usually the same day after general anaesthetic procedure is slightly impractical. It's not damaging to the tissue, but in terms of a patient being sleepy or not quite ready for it. But so generally as early as from the next day, and ideally starting within the first 4 to 6 weeks with a few appointments scheduled at intervals. But it can start very early, and it can be done over dressings and over splints.
And it must be amazing as well for those women who are feeling very anxious about, what's happened to their body and what they're going to find under the bandages when they finally take them off, to actually have somebody sort of manipulate their tissues and make them feel more confident about, being tactile with their body again.
It sort of shows them what's okay to do, and that it is okay to actually to touch the skin and to do the massage.
Yeah, and to connect with themselves again.
Exactly, and it in a way desensitizes is slightly the wrong word, but after surgery some people are very nervous and don't want to touch anything for fear of damaging or for fear of what it might feel like, and it helps desensitize that.
Yeah.
It's still being cautious, and it's still taking the proper precautions.
Yeah, exactly.
But it's helping someone to adjust to the new change and to the recovery process.
And once these women are through the sort of recovery process and things physically are healing, how do they comment on that sort of improvement, that benefit to their quality of life? I mean, you mentioned things like postural corrections. I think, is it true that breast reductions actually offer the greatest quality of life in terms of, actually sort of improving the posture, removing the excess weight, standing taller?
Yeah, of all the operations we do, breast reduction is one of the procedures that patients come back with describing the most difference. They really do. They describe feeling lighter, not having a weight sort of pulling them forward, better posture, easier to exercise, much more choice when it comes to clothing, much more confidence, because unfortunately a lot of women who come to me for breast reduction have also put up with years of unwanted comments as well.
Exactly, the psychological damage.
It's funny to make, but it's actually not. It's very damaging for those women psychologically. And breast reduction is one of the surgeries where a relatively straightforward surgical procedure can make a huge difference. And that's coming back to what you were saying earlier about people feeling guilty. Well, actually, breast reduction is probably one of the most physically transformative surgeries that we can do.
I can totally see that. Is there anything else we can do to accelerate recovery after the surgery? Like, what are the things we need to do before we even, go down that pathway?
So it's all about timing, actually, in terms of doing the surgery. Timing physically, timing psychologically, and timing in terms of lifestyle. In terms of being the best prepared and physically as good as you were able to be, optimized basically before surgery. So sometimes it's things like making sure someone's on the right medications. For example, in the older age group, making sure blood pressure is well controlled, and that's a safety aspect for surgery. For most of the body contouring and breast surgeries, weight is a big determinant of the end result. It's not about being at a perfect weight or making everyone diet furiously before surgery, but the risks are lower at a healthy weight, and the results are better, and the resuls last longer.
And maintaining a steady weight as well, I imagine.
It's also about a steady
so you're not
weight.
sort of yo-yoing.
It's if your weight is yo-yoing up and down, you're depositing fat, losing fat, stretching the skin, relaxing the skin, and all of that cycle isn't good in terms of longevity of results.
Exactly.
It doesn't undo everything, but you get better results and you maintain them for longer at a steady weight. And maintenance afterwards is good as well. For example, after abdominoplasty, Pilates is very good to maintain core strength. And actually, you could combine abdominoplasty with the M-sculpt as well, as a sort of a two-pronged approach.
Exactly.
So it's about maintenance afterwards as well.
And what about things like the post-procedure garments, the sort of support not bandages per se, but sort of corsets and bras and things? That's obviously beneficial to heal.
So they're for breasts, it does two things. It's partly the light compression, which helps with swelling, and it's partly support for breasts in the new position, whether it's with implants in place or a lift or a reduction. Everything takes time to heal in and sort of adhere in the new position. And the bra helps support that, and that's why we ask people wear them at night as well. For abdomen, it's about supporting the skin again in the new position. A little bit different to breast, but also controlling swelling, and the same for arms and legs. And sometimes we ask people to wear foam inserts for the abdomen if we've done any sort of medium or a high definition liposuction. It helps keep the contour better as someone's healing, in terms of swelling and swelling going down. And
those are sort of bespoke to the patient's body, are they?
They can be bespoke. There are standard ones available, and for most people standard will fit, but they can be made bespoke for some situations.
Exactly.
Not everyone needs them, but sometimes they can make garments more comfortable because it's like a foam pad between your skin and the garment tying over it. And sometimes they're also used to maintain shape.
Okay,
so it's a combination.
And finally, what about things like supplementation, diet? Is there anything we can be sort of intaking that is going to help again sort of with the recovery and the repair, sort of once the body has started that healing process?
So the basic advice would be a standard healthy diet that you can maintain. So something that has enough protein, the right mix of nutrients, A, to keep you in good physical shape, B, to help you heal, and C, to help maintain things afterwards. But sometimes more is needed in the run-up to surgery, and some patients do benefit from supplements like the collagen supplements and skin supplements. It all helps with healing, and actually some of the commercially available products have actually put together surgery courses, where you've got more intensive nutrients.
I think Skin Aid's done one of those. There's
So
some Skin Aid in your bag tonight as well.
Essentially, the month before and the month after surgery that you put a push on. The more important thing is your long-term diet in terms of getting your health optimized before surgery and maintaining your health afterwards. But in the more intense nutritional requirements around the healing time, you can ramp up by supplementing the month before and the month after surgery. And SkinAid are one of the companies that have specifically put programs together with more tailored versions of their products for the surgery period.
It's really interesting. Everyone seems to be obsessed with sort of collagen drinks, and I think it's interesting there's now a pre and post surgery one. One thing I forgot to ask you, the benefits of, sort of improving the scar as well, what you can do to sort of help scars heal, whether it's from surgery or from, anything really, trauma, acne.
So I think the first thing to understand is that scars take a long time to settle down. It's about 2 weeks just sealing the wound, 6 to 8 weeks strengthening the wound, and that's when scars get red and firm, and then about a year, if not longer in some people, softening and fading.
Yeah.
And what we want to do is get in the sort of strengthening and firming phase and the early fading phase to try and push it into the normalizing phase as quickly as possible. The softening and fading phase is your body's attempt to get the scar as normal as possible, and that's what we want to push it into as soon as possible. Some skin types are higher risk for raised scars or red scars or slower healing scars.
You say Caucasian sort of skin types are more prone to sort of red scars. Is that
very,
true?
very pale Caucasian skin,
Very pale.
like the very pale redhead, more prone.
Yes.
And otherwise, it's African and Asian skin types that are more prone to darker scars or more lumpy scars. But everyone can make a good scar or make a bad scar, and it's mostly down to genetics. But what we can influence are things like the firmness of the scar, itch, dry skin, and pretty much everyone, once the scar is healed enough, usually about week 2 or so, I start people massaging directly on the scar with a vitamin E cream or a plain moisturiser, and sort of a gentle but firm circular massage the full length of the scar.
Just to break down that scar tissue and help soften it.
And also it desensitizes a scar because the nerve endings to the skin have been disrupted by surgery.
Yeah.
So sometimes scars can feel odd or feel numb or feel sensitive, and light touch can sometimes be more irritating than a gentle but firm touch, and it helps desensitize. And scars also tend to have dry skin, and they can be a bit tight and itchy. And moisturising and massaging helps all of that as well.
And it probably just helps your body to feel like your body again.
Yeah, exactly. And you can supplement, that's my basic scar management, but you can supplement with silicone scar tapes or some other sort of products like Science of Skin, green tea extracts, or you can go as far as vascular lasers for scar. But my basic scar management would be the moisturising and the massage.
Okay, perfect. Thank you, Nora. That was super interesting. Absolute gold dust for anyone who's probably considering any of the treatments that you do. And our final speaker, Beata, thank you. Last but not least, I'm very excited to speak with you this evening. Beata, as she introduced herself to you earlier, is an acclaimed healer. She is the founder of, your face whisperer, I feel like everyone refers to you as, but also the founder of your own amazing sort of face massage course, which I know has been incredibly popular in recent years and COVID. So maybe, Beata, you can just start by explaining to us, you do many things in the world of wellness, but why do you think it is that women are specifically coming to see you for your treatments?
I think that we women living under enormous pressure, and we are told how we're supposed to look. We are losing right to our face, and we are losing right to aging. And we are almost pushed to the place where we're supposed to live untouched by life.
Yeah.
And in the same time, we so much want to live our life, and we want to experience life in any possible way. And then is this conflict. And this is what I find in people, in women who come into me, but also in myself, because it's my dilemma as much as it's the dilemma of women who come into me.
That's so true, actually. I imagine all three of you probably empathize a lot with the women who you see, and you know, Aggie, you said you sort of age at the same rate as them, and I think that's really empowering for women to see.
This is what I see, that conflict. And then when that conflict happened and we're losing that right to be who we are and age, and because, you know, when we are 40 or 50, we are 40 or 50. We cannot be 20. And And we have this need to stop the time. And this can be trapped.
Yes.
And this is what I see with clients who come into me. This is almost trap. If I could only look like I looked when I was 20, if I can only look like I didn't give that birth, or I didn't go through this or that in life, if I could only look like I was looking when I was 20, then I am winner, then I am accepted, then I am part of the society which built and created in a way when we are segregated in the age groups.
Yes.
And this is big issue. I yesterday had a client who came to me, and she's beautiful woman. Biologically, if you would look at her, you could say she's maybe 40, 45. I mean, when you look at her, but biologically, she's 62.
Wow.
She looks amazing. And I noticed that she came very tense. She was anxious and she wasn't like normal her. And she said, you know, I just realized that I am 61. And
It's a big cutoff point for a lot of women.
and I
or
said,
60 specifically.
yes, but yes, of course. But in her case, it wasn't what she was seeing in the mirror. It was that realization of that number, which means something according to aging groups which we live in, because this is how this society operates, which is very brutal.
And you must have seen it change so much, because how long have you been doing
Enormous.
what you do?
24 years.
24 years. It must have been very different when you first started, the reasons that women were coming to see you versus probably how they're coming now.
When women were coming, I always was going towards holistic part, and I was always trying to encourage women to start from accepting and loving, and then see if they need other changes, different changes. And but women were coming more interestingly. Women were coming more for doing some fixing
Yes.
their faces. And there was lots of issue about wrinkles. Women were coming to me who had that first wrinkle, and that first wrinkle was almost like a sentence. I could really hear that. There was lots of fear behind that, because that first wrinkle meant I'm getting older.
Means that more wrinkles are going
And
to
we
follow.
don't have a good relationship with aging. We don't have a good relationship with getting older. We are afraid of that for many reasons. This is for separate conversation.
Yeah.
But now it's changed. Actually, women who come to me now, they want to embrace themselves.
And I think they're much more accepting of healing and the sort of more
Yes.
holistic treatments. You know, I think.
Yes,
You know,
they're coming more for healing. They're coming more for learning how to love who they are.
Yeah. And I think
more
probably.
now than before.
I think probably 25 years ago, 24 years ago,
Yes.
probably we didn't talk about holistic method. I feel like I use the word
No,
holistic every
no.
single sentence at the moment, because it's so integral to the way that people live their lives, particularly wellness. And
If you look at the definition, it's a holos. It comes from Greek word holos, which is wholeness. When we think about mind, body, and spirit together, because we are spiritual beings, we are energy field. You go into the room and you can feel the energy of the room. We all
It's so
feel
true.
that. So we are that energy. So what we think, what we say, somehow create who we are. And that is why that relationship which we have with ourselves and with this aging bollocks, please forgive me that, but this is just crazy what is happening.
have you seen our attitudes to healing change in the past?
Yes.
25
very
years.
much,
Yeah,
very
because it
much.
didn't used to be spoken about so much.
Yes.
And it's a big part of what you do.
Yes, when I was trying to say that I'm healer 24 years ago, it was almost nowhere. And if I would say on the top of that I traveled to Africa and was initiated by shamans from Botswana and Namibia, I wouldn't dare to
You'd have
say
lost
that.
like anyone
I
who was
even
about.
came back from one of the trips when I worked with 5 Botswana shamans, and they offered me kudu skins and the turtle powders and
Wow.
the drums and everything, because this is what they use in shamanism. And I said, well, what I'm gonna to do now with that. And in that time, I was working in Fenwick. So
Your
I could
average
see
Fenwick shopper
myself
was
in the
up the
photo
African
screen in
drums.
front of the elevator. Of course, it was not possible, but now it really changed. We know that we need to heal in order to feel fulfilled and
Agreed.
happy. And you, Nora, was talking about the physical wounds, but we have emotional wounds. And these wounds needs to be healed, because if they are not healed, they will be seen on a face first.
And how do you go about identifying those wounds that you see? So you see them in someone's face when they come for a
Yes.
session with you?
I am fascinated by face, because for me, face is like a map of the human life. And I personally love wrinkles. I'm really sorry for saying that, because for me, they are signs of your life. Every wrinkle is story behind that. It's that divorce, or it's that change of work, or it's that children who left.
But
This
there are
is
also
all in the
negative
face.
wrinkles. You know, that there's a reason we call, you know, the ones around our eyes
Yes.
laughter lines. I think they're also
Yeah.
a sign of a life well lived.
Yes, they are, of course, but also they are faces, they are grimaces of the face, which sometimes coming from emotional memories which are frozen in us. For example, when we are children and we're not receiving that love and appreciation, our face forms in a specific way. And then although our life change, we look at the mirror and that face still represents that old wounds. And then my work comes when I'm trying to release that holistically, using my hands, using massage oil, using my techniques, but also trying to heal that traumas which are underneath, because that traumas is always seen on the face. I'm always saying that the first tool to beautiful face is relaxed face.
Because then I suppose you soften the face, you soften the muscles and everything. You know, the blood flows again and the face comes back to life.
Yes. And for that healing has to take place.
So what's the healing technique that you use? What would the client experience when they lie on your treatment table?
So I work, it's a complex work, depends what person need. I of course do my face massage techniques and face therapy. I worked for a long time with people who really had problems with face, like Bell's palsy or even injuries as well. But a part of physical work which I do, I really look at the story behind that, like you mentioned, Nora, about it, and the wounds that people carry with them. I am also very aware that women who come into me, very often they are women who go through menopause, who are in a long relationship. Sometimes this relationship goes to end because of the years of being together, and that combination of menopause and that tiredness of the relationship and enormous pressure, social pressure, it has to be addressed.
You must see menopause actually being something that affects many of your female clients as well.
A lot, because there is stigma around that. Menopause is like sentence you out. You are not in a game anymore. How brutal it is. This is, once we go through this menopause, this is completely different life for us. And we are told because we are not fertile, we are out of the game. And this is again this old concept of society in which we live. And I believe that together with raising consciousness, together with conversations like we have, we have a chance to change that model in which we are women put in with almost no power to change that.
I agree.
I'm sorry, I'm not responding to your question.
No, you're going off on a tangent, which I kind of
I'm
love,
sorry.
because it means that we don't have to stick to my scripts. It's
sorry,
great.
I'm
No, it's
sorry.
perfect. Carry on. What was I going to ask you
we
next,
talk
though?
about
Because now I've lost my train.
Yes. So theta. So for example, I use theta healing.
Yes,
So
theta
I
healing.
use physical work, I use my hands, but I also use theta healing to look at these old pains, these old experiences, these painful experiences, because they will not disappear unless it's healed, complete. then the light comes.
What does
to
the
the
client
face.
experience whilst you're doing the theta healing? Is there any physical sensation? Like, do they notice an effect? Does it take a
Yes,
while to come
yeah.
about?
They notice effect. They think differently. They feel differently. They look differently. I was talking about this light from inside. The face starts to lighten up because it comes from that healthy place. And also in a moment when we start to heal our old wounds, we have much more self-acceptance.
That's
and
so
we
true.
have much more self-love and self-tolerance. We're beating ourselves. You were talking about it so much. But it has to come. We need education how to love ourselves. And I use
true.
my work, my physical work and my theta healing work to help women in that education, to remind them that they have a heart, to remind them that their face is unique because it's theirs.
It's such a lovely philosophy. And your hands-on work as well, I think, is so pivotal to this conversation, because I think the power of touch is something that we don't speak about enough as humans. And in fact, I remember when COVID first became a thing, everyone was we were really suddenly acutely aware of what a lack of touch could do to us. People who are in isolation, women who live by themselves. And I think, this is how your face massage classes came about, didn't they?
Yes, I was always big advocate of touch. And touch is first sense developed in embryo. We respond to touch even when our face is not fully developed yet. This is the first sense how we recognize reality through touch. It's fundamental. And I spent all my life to talk to people how important touch is. And we have so many bad association with touch as well. And surprisingly, if touch was associated with brutality or violence, we don't want to be touched anymore. If I can just give example of that, many years ago I was asked to go to centers which were for young women. They were girls, literally, from 13 to 17, who got pregnant, usually through rape or violence. And then they had their own babies. And the woman who had these 3 centers, she came to me and she said, what I can do, these women don't want to touch their babies. They don't want to do
so
that.
Sad.
And I said, of course they don't want to do that because they have such a bad association with touch. They need to be touched and they need to be educated that touch is good. So we started to go to them and massage mothers on a regular basis. And we could see with time that something was changing, finally to the point that they found this connection with their own babies because they reprogram that negative connection with touch. So
and I'm sure that
really
the power
important.
of touch is also about sort of releasing the endorphins and the serotonin, and on a hormonal level, I think it's very
And that
powerful.
is why classes, when lockdown started, I was almost in tears. I thought, my God, all that work to encourage people to touch each other, to hold, to hug. And then I went on the street and I saw people really walking 5 kilometers from each other. It was March 2020. We didn't know what is going on. And I thought, what I can do? How many people are now locked in their houses? How many women are locked in the houses alone? Nobody can touch us. I was in the same situation. I was single. And I thought suddenly it was moment of aha. I said, I need to do online classes, face massage online classes. And this is how I started. And the whole classes were, of course, partly it was about showing the techniques, lymphatic drainage and myofascial release, everything what women can do to themselves. But this was also about providing them with the tool that they can give themselves, that touch, that hold,
and heal themselves.
That love. It was very, very important in that time. And 2 years later, I still do that.
It's an amazing initiative. I mean, what are the sort of key points on the face? Maybe you can even sort of demo to us, like that can help relax and, soften facial muscle.
I would say the
muscles.
most what helps it's love, self-love. This is the most. So this is first, because then whatever you do with face, you don't do that from that space of being angry with your face, of looking for what is not there, but you rather do that from the sense of tolerance and acceptance and love. And this really changed the game. That is why relaxation is so important. When the muscles are tight, whatever you do on these muscles, you will not change that appearance. But so maybe I would just invite you now to some breathing maybe, and touching your face in a way that maybe you will experience that moment of relaxation. Yes?
Yes, go for it.
Okay, so sit comfortable, and I can invite you as well. Sit comfortable, make sure that your back is straight, hands are relaxed, there is no right wrong, and just close your eyes. Close your eyes and just take deep breath in through your chest, and open your mouth and breathe out through your mouth with this kind of gentle relief sound. Just that. And again, breathe in and out. Great. And again, in and out. And now place your hands on your face. It's very intimate. Cover completely your face with your hands. It's very intimate, but don't feel embarrassed. It's nice, very gently. And just start to connect with your face. Breathe towards your face. Just breathe towards your face and imagine that you're blind, and you just gently touch your face like you would never touch it before. And if that face could speak, what that face would say right now, if there is tension there, where is that tension? Just recognize that face for a moment. And now place both hands on your temples, just like keep your eyes closed once you sing. Just on your temples flat, close your eyes again and gently circulate up and out. Flat hands. Just breathe and really allow yourself to sink into that, to release that tension very gently. Whatever tension is there, just breathe this out. Now place hands at the back of your teeth. When you move your jaw from left to right, you will feel that movement. Again, close your eyes. Press gently into that back of your teeth and make small circles. Usually there is so much tension there. You hold your life, you try to be strong. Just release that. Release that. Just circulate. Breathe regularly. Don't be afraid to be gentle, tender, loving. And now place hands on the face again, completely. Just breathe in, and on an out breath, just say thank you to your face. Just thank you. And take your hands off. Just release.
Yeah, it's like a mini power nap. That was amazing. It's interesting as well, because you're right, it's not about doing it with a lot of vigor or force. Sometimes, you do have to be gentle.
Depends. Sometimes I work, really, it's a pure myofascial work, especially with women coming with lots of tension in the face, which almost that tension is freezed in the face. So then the work has to be very, very gentle, and especially when I work with people who really have problems with the faces, like Bell's palsy, for example.
And tell me about where the meditation fits in as well, because that's another important part of your...
You mentioned something very close to my eyes, because in my brand, Beata Love Life Beauty, meditations are on the first It's the first point is meditations. And why? Because I learned that if we are very tense, we wear that face in a very tense way. And meditation, which is obviously, we know that it has amazing effect on the central nervous system. It allows us to relax, to connect with ourselves, to be here and now. And then almost every system in the body goes in the state of nourishing and self-balance, which has impact, immediate impact on the face. But with meditation, the problem which I found is that there is stigma around meditation, because there is all these gurus out there who expect that we will meditate for an hour, and there is one word, breathe deeply, and then it's half an hour nothing, and who can do that?
My mind has always wandered when I've tried to do meditation like that.
So I tried to create meditation which are 13 minutes long. You can do that every time of the day. It's not long, and they are guided meditations. So you are not lost, you are not left alone in that silence, which for many of us is really too much. It's too challenging. But when that meditation is guided, then it's much easier to go through these 13 minutes. And meditations are about forgiveness. My meditations are about gratitude, and to remind yourself about everything what you have in life, rather than to focus what you are lacking. Meditation is about sleeping as well, because sleeping is really the beauty medicine. It's the best beauty medicine. About connecting with your face, discovering that beauty of your face, connecting with your heart. So they are short, but I have a very good feedback from people who got them. So they must
all need to try them after your face massage as well.
And the sleeping, if I can say one word on that. We all know that we need to sleep, but I really would like to emphasize that we have these 5 phases of sleep. Maybe some of you know that. Why I'm talking about it? Because that 5 phases which last around 90 minutes, and then it repeat again for around 5 times overnight. If you don't sleep properly, you don't go through these 5 phases, which means you're not able to nourish yourself emotionally and physically. Because first phase is just, it lasts 5 minutes, you're just preparing yourself to sleep. Then you have this a little bit deeper phase. Then you have a really deep phase when the restoration and rejuvenation of every organ in the body is happening, including our face. And then we go even into a deeper stage, and then we have a dreaming. And the dreaming comes not earlier than around 90 minutes of deep sleep. And the dreaming is important because dreaming is partly recycling everything what happened in our life, in our day. We need
it's helping us to process what's happened.
Yes, absolutely. Otherwise we go in banana. We need that dreaming
it's like a detox
phase.
for the mind.
It's like a detox. And interestingly enough, when you see people who go through this rapid eye movement, their eyes are rapidly moving, but legs, arms not, because we are designed by this amazing creator in a way to make sure that we will not act upon our dreams.
Yes.
That is why we really cannot move, but we can process that. And then once that phase finished, you start again all these 5 phases, and you go up to 5-6 times overnight, and then you are relaxed. So sleeping is fundamental. It's really, really very important to go through all these 5 phases.
It's such an interesting example of how the body and the mind work so powerfully together.
Amazing.
The mind's doing something to help repair and heal the body every single night. Thank you, Beata. That was super interesting. I love that whole sleep explanation at the end and the face massage. That brings us to the end of tonight's conversation. A huge thank you to our amazing panelists, because you've I think what you've all touched upon independently is the real sort of psychology of actually understanding your patients, your clients, as much as it is performing, the manual hands-on treatments or surgeries, or, using your Scalp Neos or whatever it is you're doing. And I think it really goes to show that there is this need for the modern day healing that we're sort of here discussing tonight, and hopefully in the hands of the right therapist or practitioner and using the right modality, we can get amazing transformations like the ones that all of you have actually spoken about. We do have time for a Q&A at the end now, so if anyone does have any questions, please pop your hand up. We also have goodie bags for you, so please don't leave those behind as you come to leave. You can't miss them. They're the beautiful sort of Monjan canvas bags by the door. We've got some beautiful things in there for you. We've got skincare from Ela, from Germaine de Cappuccini. We've got Kurami and Skin Aid treats. We've also got an amazing voucher from Beata for one of her face massage classes.
Yes,
So go and do more facial massage. Complimentary.
Thank you. English is my second language. Yes, and also there is oil and massage cards for you to look at. Maybe you'll be interested to learn more about it. It's on the table.
And we also have a very generous voucher from Dr. Aggie for her Italia clinic as well, towards a skin analysis, so you can all get to know your skin and what lies beneath, scary as that sounds. Not this time. Maybe at the next talk. You never know. It will appear in these goodie bags. There's also, I should have said this at the very beginning, there's a program on your chairs, so you'll have sort of more information about our speakers there tonight, and on the back there's a referral card. So if you'd like us to connect you with anyone that you hear speak this evening, then tick the box and we'll connect you tomorrow. But in the meantime, were there any questions? Any burning questions? Hi there, how are you?
Yeah, really well. Thank you so much for today. It's really insightful as well, the conversation. Honestly, it really helps. I was just going to ask, if you recommend a skin supplement, it's maybe more for Dr. Aggie?
Yeah, exactly. I think this is a nice one for you to take. Would you recommend a skin supplement? This is a skin aid.
There is a sample for you to try in the goodie bag. The jury is still out in terms of collagen supplements. So there is still a little bit not enough data from clinical practice. I think it's helping us to achieve optimized results. It's almost like we're trying to boost our collagen production, and at the same time we're delivering those building blocks. It's easy to reach out for them and build this new collagen. That's my theory. I don't know if you agree, Nora, but I think
I think the newer products like Skin Aid or Zini, I think for me the format is important.
Yes, it needs to be hydrolyzed collagen.
Because if it's not hydrolyzed, you won't.
What does it mean, hydrolyzed?
It's how it's broken down, because otherwise you don't digest it.
You would drink it and wee it straight out.
Goes through.
Just goes straight through.
So it needs to be absorbable
right
by the body
exactly.
in some
So
way.
Marine, good quality, hydrolyzed collagen.
Because a lot of the supplements that were previously around actually did nothing because you didn't absorb them. So the hydrolyzed collagen you absorb better.
Yeah, okay, perfect. And you think the drinks are better than like a powder or
generally,
a tablet?
Yes.
Or
The capsule is easier. It's more convenient.
Yeah.
But usually the drinks are a slightly better format.
Yes, perfect.
More absorbable.
Beata, do you have any thoughts on supplements? Is there anything that you swear
Vitamin D
by?
before I will vitamin D in January.
Yes, true.
Yes, I'm talking about vitamin D, vitamin C, absolutely very good, because it's highly repairing vitamin. It's very good, ideally in a powder form, vitamin E and omega.
Okay.
Omega.
Yes, omega, which is really good for sort of mood boosting as well. I feel like again nice at this time of year. Super.
And healthy diet, that's all you need really.
The number
You
one.
don't need to take many supplements, in my opinion. It's
if you can get them through your diet.
I would just say in the supplement front, if you are considering surgery of any description, tell your surgeon what supplements you're taking.
Why is that
Because
important?
Some are fine generally, but they can cause more bruising and bleeding around the time of surgery. Omegas, turmeric,
yes, that's
St.
so
John's
true with
wort,
omegas,
even primrose oil.
Yeah.
It's not a problem in the long term, but I would usually ask you to stop about 2 weeks before surgery and restart a week or two afterwards.
Exactly.
So just if you're asked for medications and things as a screening to before surgery, include everything, because some things are absolutely fine and good for you in general, but in the run up to a procedure it can cause bruising or bleeding.
Yeah, and the vitamin
HRT is generally okay. There are some, hormonal treatments like HRT and the contraceptive, we look at them in terms of risk for clot formation in the context of surgery. But generally, we wouldn't make people stop HRT. Generally, that's fine. We ask about it, and so we'd want to know if someone was on it, but usually that's okay.
I have a quick question about vitamin D, just because you mentioned it, Aggie. It's one of the vitamins that we're told we can't absorb all that well through food, so we have to get it from sunlight, which is why we then have to supplement it in the winter months. But I don't know what your perspective is on this, because I'm sort of a religious believer in wearing sort of SPF 50 every single day. However, if we wear the SPF 50, then we don't absorb the vitamin D. So where do you stand on that?
I normally suggest during the consultation, to use SPF 50 and vitamin D at the same time.
Okay, so you would supplement rather than trying to get it normally.
I think majority of us are in need of supplementation of vitamin D.
And we're not going to get it right now, to be frank, anyway, are we?
Getting enough of it.
Yeah, I mean, I think I would agree with that, and I think the problem with SPF in the UK is people assume when it's cloudy you don't need it.
Yeah, exactly.
But you still get UV exposure. Whereas if you're actually out in glaring sunshine, a lot of people are actually quite good at using it
for
all year.
But it's the non-sunny days that people fall down on.
That's so true. Were there any more questions? Just the one good question. Well, if you have any other questions, then our panelists will be here for a little moment longer, so you can always ask them then. But yeah, just from me, a final thank you to you amazing ladies.
Thank you for
asking. No, not at all. So much indispensable wisdom and tips and tricks, which I'm sure all of us will be benefiting from. And thank you to all of you as well for coming tonight. It's been so wonderful to have you, and we'd love to see you at more events, so please come along. Our next one is on the 7th of February at the Lanzerhof at the Arts Club, and you can get all the information you need on our website and sign up to our mailing list if you're not already. It's thebeautytriangle.com, so no excuses. And don't forget your goodie bag on the way out. Bye.
Thank you. Thank you.